Hey, this is Matt Ertz, the Madison County Historian. We are still working to document the ongoing COVID-19 pandemic. We are lucky today to have with us Mark Scimone, the Madison County Administrator. Mark, thanks for being here today and talking with us.
Thank you, Matt. Appreciate it. And this is a great series you're doing to document the history of the COVID-19 outbreak, not just for Madison County, but for all the folks in the country. To see these videos one day will be pretty cool.
Yeah, well, and it's funny. We've been talking about this with other historians. You have this, you have the protests that have outbroken, and you have a presidential election. So this is going to be a year that's looked at 10 years, 20 years, 100 years down the line as probably some sort of seminal moment in history. And hopefully we have a really good record in Madison County. We've been trying to document as much as we can. But today we're going to talk about...
They said that, the Marty should not go back to the future to the year 2020. This is stay away from 2020.
That's true. That's a great reference. All right. So we're talking about the COVID stuff, and talk a little bit about, from the county perspective, when did you guys start to see COVID pop up on your radar, and what was the initial response?
It's interesting because Eric Feist and I, the public health director, had a discussion in December. I called him one, morning, and the COVID stuff was starting to hit, and China and everything. It was just kind of like around Christmas time, or maybe between Christmas and New Year's. And I said, "What's this COVID-19 thing? Is that something that we'll have to worry about in Madison County?" And Eric's like, "I'm not really sure." And they're putting restrictions in, and maybe we'll never see something like that here. And then a few months later, here we are. And the first really time we talked about it, we had a presentation with Eric with our board on, I think it was the 12th or 11th of February. He did a presentation to the board. I told the department heads they really should be there for the presentation. He went over the presentation. COVID was here in the United States. It was spreading. We were very matter of fact about it. It was interesting because at the time, we didn't really think about us, how it was going to impact us. We talked about it, but it still seemed far away. And then kind of after that time, things just blew up, which I'll talk a little bit about when we talk about timelines of what we did here at the county. But things changed really rapidly. And it's kind of amazing to look at how quickly things developed and kind of where we're at today.
Okay. So talk about the decision process that you guys went through. Some of it was mandated by the state in terms of the closures and going to 50% in that, but talk about, you guys are going through this process of, are we going to close? If we do close, how do we respond? How do we make sure that essential stuff is maintained and taken care of in that process, dealing with the board and dealing with, your level?
Yeah. And so, that process started pretty soon after February 11th. I first asked departments on March 6th to put together plans for what is their essential function. So not so much the essential employees, but kind of the core services. What is essential? What do we have to provide? So be looking at those items and start to put together your list of things that are the core functions that we need to do. And kind of our emergency operations, what we do if there's an event of emergency. So it's kind of interesting. You look at that email was sent out on the 6th. And at that point, I'm not thinking we're going to do anything with it. We're going to have a plan. We're going to be prepared. But I'm thinking in the back of my mind, yeah, it's good to do this, but never imagine kind of where we would end up. And so we put that together. And then after that, we had a department head meeting on March 12th. So 6 days later, Dan DeGear, our emergency manager, put together a tabletop exercise on what does a emergency services look like for county services. Nice tabletop with the department heads. We reviewed some plans that we had from the department heads that had been submitted so far. So now we're in a department head meeting. We're here at the chambers. We're talking about the what if and what the plans would be. And then, you look at what happened after that, I sent an email that day on the 12th at the department meeting, and I have it here in front of me. And one of the things, I'm just going to read you this paragraph of the email. It says, Madison County leaders are evaluating certain work assignments that may be appropriate for telecommuting purposes in the future and assessing which programs, responsibilities, and staff are going to be considered essential in the event of a building closure. The term essential personnel is not meant to reflect the employee's value. It's merely a way to identify which staff will need to report to work in the event of the county closure. Telecommuting and building closures are only theoretical at this time. So remember, this is March 12th. The county is hopeful that these measures will not be necessary, but recognize that we need to be prepared if the measures are necessary. So this is March 12th. That email goes out. We have the department head meeting. March 14th was a Saturday. Things at this point were starting to really get hot. I came into the office on that Saturday to kind of finalize the plans because I had everything together and I wanted to put it in a format that we could review. That same day, Chairman Becker comes into the office along with emergency manager Dan DeGear, and we're talking and we make a decision. Let's have a government operations committee meeting on Sunday to start to review these plans. We scheduled a meeting. We invited the full board. We had the meeting on Sunday, March the 15th with a full board. And at that meeting, we approved all the departmental plans that were submitted. Also at that meeting, we issued a state of emergency for COVID. So that's now March 15th. So remember, we started with me just putting stuff together on the 6th, and now we're at the 15th. We declared a state of emergency. We had our first case, and we're meeting with everybody to go over everything. So that was all approved. So that's Sunday. The next day, March 16th, which is a Monday, governor issued the order to go to 50%. So thankfully, we were prepared for that. I sent out another email to all the county departments saying, we're not closing, but we're going to reduce, the services. We need to start, getting people, planning on people, leaving the buildings. But we're not closing. Everything's going to remain open, but we're going to start executing our plans to reduce services.
So let me ask you something.
Sure.
While you're in there, were you getting any guidance from the state, or was this you finding out kind of like everybody else was when the information was released?
So that's a good question, Matt, because when you look at the email that I sent Monday, March 16th at 12:57 p.m., second paragraph, the governor I capitalized and underlined, without informing local government officials, ordered local governments to reduce staff by 50% by the end of the day. First time we heard about it, it was at a press conference. Okay. No heads up. Like, we're hearing it from the media. It's insane, right? And now I'm scrambling with our staff to try to figure out what we're going to do. And that's on Monday, the 16th. One day later, March 17th, I'm sending an email to the employees again. Effective close of businesses Friday, March 20th, 2020. Madison County will be closed indefinitely.
I remember you were leaving on the 19th while you and Chairman Becker were walking together, and Chairman Becker turned around and said, do you know if the county has ever closed like this for anything? And I ended up going back and looking, and I cannot find any reference. There were events, there were days where things happened, but not just this open-ended, we're closed until we're open again. And it doesn't appear there was a case like that.
Yeah,
so
it's insane. But so now we're looking at, for the history standpoint, March 6th, we're thinking about things, and March 20th, we're done.
Yeah.
Yeah.
So 2 weeks.
It was a wild, so that's just the first part of the ride. Now, the second part is just like coming into the office that next week, and there's nobody here.
Right.
Except for the joint information center that was put together with Sam Field and her folks, and then Dan and his folks from EM. It was really crazy and really eerie here in the complex, and how to try to take that in and how quickly that happened, it was just, you know, and what was left over was really wild to see it.
So as this process comes on, talk a little bit about, we talked with Eric, the public health director, last week about the specific events, but talk about, as you guys find stuff, you're working very hard to disseminate the information, but at the same time, you know, you're communicating with state and federal officials about what's going on. Talk about that process and how, you know, everything was done. We talked to teachers. Everything was almost done completely on the fly, minute by minute, day by day, because you couldn't really plan ahead because you didn't know what was coming in the moment.
Yeah, we learned everything via press announcement, basically, you know, and that was difficult for us because we were having to react to things that we were hearing in the press conference and not getting the information from the governor's office in advance. And that was a frustration. We would have these 3:30 phone calls with myself and other Central New York leaders throughout the region. And we would always complain, you know, on the 3:30 call that, like, you guys got to give us this information. We can't find out about it when the governor does his address. We need to know before, because we need to be prepared to answer the questions we're getting from our public and our staffs. So it was really frustrating, you know, and when you look, and it was in the early stages, and that's just kind of how it went. You know, one of the worst things that happened during this was, this more recently, is phase 2 of the reopening.
Yeah.
And so I could tell you from a historical perspective, you know, I'm on the regional control room calls. So it's the 5 county leaders. I'm there with Chairman Becker, but it's Onondaga with Ryan McMahon, Paul Hyder, the chairman of the board for Cayuga County, James Weatherup, the chairman of the Oswego County Legislature, Eileen McDabb Coleman from Cayuga County, and then Chairman Becker. And we're being told all week long before the reopening of phase 2 that we're good to go. The numbers are there. Everybody's set. You guys are good to go. And then there's a press interview with the governor on NPR on Thursday, you know, like 1 o'clock in the afternoon. And he notes that he has 2 experts that need to review the data and that we're not opening on Friday. And we're like, what? and we had a call scheduled for 2 o'clock, you know, for the region, and it was moved to 7. So on that call, they confirmed that and said, we're not opening. And I'll tell you, I've never heard so many angry leaders in my life, because for 40 minutes straight, led by County Executive McMahon, followed by Chairman Becker and others, it was not pretty. They said, you guys told us all week long we were good to go, and we find 11th hour. Like, why are the goalposts being moved now? What is this about? Who are these experts? What do they know about our community, you know, that we don't know? You know, we have local public health experts in Madison County, Onondaga County, the region. We look at the numbers are good. So why are we now being held hostage and not opening? And so we, Madison County, decide we have a press conference on Friday. We're going to just announce that we're opening, right? That's how it's going to go down. And we moved our press conference to 1 o'clock because we wanted to hear what the governor had to say. The governor gets on at 1 o'clock. He opens everything for phase 2. So it was wild. And since then, the communication has improved, especially on the phases. But then when you look at what's going on right now, you know, what is phase 4? We don't know. It's entertainment. And what happens after phase 4? And we're asking those questions, what happens after phase 4? And then nobody on the calls has an answer. You know, we have a lot of restaurants here in Madison County that want to open, but they don't want to open at 50%. They want to wait to 100%. And so is that phase 4? Or is that phase 5? We don't know. So that's been a constant, and I'm moving us kind of farther in the future, but that's been a constant process throughout with the frustration from, the lack of information. So.
Yeah, as we've talked, I haven't talked to a ton of business owners, but the few that I've talked to, that's been one of their things is there's this, they list like 3 jobs that are definitely open. And then you go, well, I'm kind of like that. I think I'm open. And then you'd see a newspaper article that says, oh, no, you're not part of that. But then, other people would open, again, distilleries and these different things that have some of them have opened and some of them haven't. It leads to this really confusing, in some ways it depends on the owner and whether they're willing to take the chance. Talk a little bit in the last few days, Governor Cuomo has talked about, and I'm kind of paraphrasing here, but the responsibility of local governments to enforce the rules and what that means to us as a local government. How are we doing this and how are we supposed to even do this when it seems very broad and very, very difficult?
Yeah, with not a lot of resources, because in vain, there's talks about us being cut 20 to 50% from the state and our sales tax revenues down. We have 4 nurses in the health department and, we don't have the staff to follow every business around to see what they're doing. We get complaints in, we investigate them, we deal with them. But as far as like being proactive and we don't have roving groups of health department officials or sheriffs that are like checking every single business's door to see, are they wearing masks? Are they social distancing? We just can't do that, especially with the rural nature of the county. So it is frustrating and we don't have a lot of guidance. It's our responsibility allegedly, but these rules were set by the state. It's one of those, unfunded mandates.
Yeah.
Do as I say, and we're not going to give you the money to support it. So, we're taking the complaints seriously. I get copies of any complaints that are submitted to the state, and I'm working with Eric and RJ Lenhart from the sheriff's office to, if there's a business that's not wearing masks, we're sending letters, we're following up, we're visiting them. At some point we could end up, getting into some fine situations for repeat offenders. But it is difficult with the rural nature. But I will say, I've been getting a lot of emails from the state. They have a hard time, figuring out Oneida County compared to Madison County. I think 5 or 6 businesses that have been blown in so far are Oneida County businesses. And so I shot an email over to the governor's office the other day and said, hey, you guys keep dinging us for all these Oneida County cases, and the governor's threatening us. He's going to shut down businesses because we're not enforcing. I said, we can't enforce things that happen in another county. And I said, it's really frustrating. You guys can't get this right. There's Google and look at a map. And so the governor's office wrote back and said, they apologize. And that we have, as a county, we have some of the lowest complaint numbers in the state.
Wow.
So it means our residents and our businesses are doing the right thing. They're wearing their masks, they're social distancing. So we're not getting a lot of complaints. The complaints we get, we address, but we can't go out. So we have to rely on the public really to tell us where the issues are, where the hot spots are, and we'll follow up with that.
So 1 or 2 more questions. The county had taken this big initiative to push rural internet, and it seems like more and more as we open, that's going to become an issue, especially for school districts. Talk a little bit about kind of long-term. That's one thing that popped in my mind, but how you think COVID will impact Madison County in the long run with stuff like that. Will it help us get better access to internet, or is there things you see where you can go, yeah, I can see where this is going to go now, or are we all still just kind of throwing our hands up trying to figure it out?
Yeah, and the good thing is pre-COVID, we were way ahead of the game when it comes to rural broadband. We work with a company called ECC, and we developed a USDA broadband reconnect application, which basically that application, it's a $15 million program or $50 million application we put in that would bring broadband to unserved and underserved areas of Madison County. And we threw everything we could at this. And it's a really great application, and we're really optimistic that we're going to get this funding because we think we have a great application. And so we're really ahead. And submitted. It's funny because that process was going on at the same time the COVID-19 was. Actually, the initial deadline was middle of April, and we got some extensions, and we worked through the pandemic and the early stages to get our application in and complete. And we have support from Senator Schumer, Senator Gillibrand, Assemblyman or Congressman Brindisi, Assemblyman Salka, Senator May. We got a lot of support on this application, and it's really comprehensive. So that's one piece of it. So we're hopeful, but we're hearing that through the federal stimulus money that's coming, there's gonna be more money for rural broadband. So whatever we don't get, or if we don't get something with this one application, the great thing is we have the data now in place where we can spend on our application. We have the maps. We have, the company we hired literally drove every square mile of Madison County looking for holes. And we have a map that shows where we have issues and where we don't. So we have all the data. So as more of these programs come out, we're in an awesome position to get money. So I'm really hopeful for the future of broadband in Madison County, that we will not only be connected, but we'll be able to bring in more competition, which I think is an important thing for our residents. We have Spectrum and we have Frontier, the two big providers in the county. And we're looking at, as part of our application, we partnered with a company who are nameless at this time, but we partnered with a company who jointly submitted the application with us, where if we get the grant, we got another person, another group coming in to provide a high level service to our residents. So we're excited about that. There will be opportunities outside of the USDA application for us to get some funding. And we're in probably of all the counties in the state, we're probably in the best position right now because of the work in the forefront that our Public Utilities Committee, led by Evan Schwartz, Chairman Becker, made this, his priority for the Public Utilities Committee from the beginning. So it's been a good effort, and we're excited about the future for broadband. And it's critical because as kids, have to do schoolwork, remote learning, and that stuff, which, by the way, I'm a big fan of in-person education. The tablet stuff is good for temporary, but we need to get our kids back to school. As a parent, with,
and it's
back to school.
Having talked to superintendents and teachers, they're all the same mindset. Everyone should be back at school, but that may not be possible, and there has to be a better way to get access. Yeah. What other long-term changes do you think COVID could have on the county?
We're doing we have about 80 employees right now. So just to close the timeline on the closure of the county complex, on May 12th, I sent an email to the county employees saying that effective May 18th, we're coming back at 50%, other than those that can work from home. And then on June 8th, we brought everybody back 100%, other than those that are working from home. And we have right now, currently, it's appointment-only services for Madison County government. And we're looking to the future of how do we open the building back fully. We don't have a date for that yet, but that's going to close that time. Right now, we're back, other than the 80 employees are working from home. And I think that's going to be part of the future, because if you look at, I'm going to give you an example. I think the best example, mental health department, and what they're doing with telepsychiatry. It's amazing, because one of the issues we've had over the years with being a rural county is transportation and poverty. Mm-hmm. And so it's hard for folks to get here to the mental health department to do their clinical visits. And, and they're not only just coming themselves, but they're having to bring their family with them because you can't leave the kids home. So we're having, 5 or 6 people coming into the mental health department for a person's appointment, and they're coming into the building, and they're in the waiting room, and they're going in for their hour appointment, and then they're getting out and they're getting back in the cab to go back home. Now have that option with telepsychiatry. For some folks, it works really well, and we've gotten a lot of positive feedback. So that's just one program. We think that we're hoping that right now they did a temporary waiver for Medicaid billing, so we could bill remote telepsychiatry. With the past, you couldn't. We're hoping that is permanent. because we'll keep doing it. There are some cases where you have to do it in person, especially for crisis, especially for high risk. But there's a lot of people. I just talked to Mental Health Director Tisha Cook yesterday about this. There's a lot of people it works for, and we want to continue that. So I think it's just kind of reinventing what local government looks like and where we can work from home, and also the provision of services online, getting away from in person and doing as much as we can online, whether it's paying your taxes, doing different transactions with county offices, where we can limit people coming into the building. It's great. It's nice to have people in the building, but in the future, not just with pandemics, but it's just even for folks to have to, get in their car, drive to Wampsville, do their services, which, we're open during the year, normally 8 to 5. A lot of people work. They can't get to the county for services. By the time they get out of work, we're closed or they're having to take time off. So provision services online, stuff by appointment and work from home are some of the things we're looking at going forward.
Yeah, I talked to Mike Fitzgerald, the Commissioner of Social Services, and he talked about one of the big things that benefited them was the state putting in a program where people could snap a photo of a record and upload it to the state system rather than trying to find a scanner or go into the office and have them scan it and upload it. So that literally the person, they go, well, we need a pay stub. They can take a photo with their phone, upload it, and it's done. And he said that made life so much easier. And I think he said they launched right at the end of March, and they'd done like 800 to 1,000 documents already uploaded by people from home, so they didn't have to come in the offices. It's stuff like that that seems real simple that could make everyone's lives involved significantly easier.
Yeah, I mean, it's funny. I was recruiting for a position right before COVID-19, and with the new generation of the workforce, one of the questions the younger person asked me was, does the county do work from home? I said, no, we're government. We don't do work from home. That's a private sector thing. And then, that person I hired, and guess what? She's working from home today. So it is amazing. And I think if there's anything that's good that comes out of it, it's getting government in with the times and be able to provide more services to our residents more effectively, more efficiently, and having people be able to do things like Mike said, take a picture of your paperwork and submit it online versus having to drive from Brookfield to Wampsville to submit your paperwork. It's an hour drive.
Right.
So,
one way.
Yeah, one way. So you're losing 2 hours for the day. So that's a really good thing, and that's that's probably the most exciting thing to come out of it. But we're still in it, and we're still in the middle of it. And every day changes. It's been nice, really since June 8th, having the employees back and being able to do a lot, with folks here and not work on COVID stuff. But I got to give a shout out to our employees have been phenomenal. I mean, across the board. And they've been patient, and, they've done their work. They've worked from home. And then on the response side, Samantha Field, PIO, has done a fantastic job being our shield with the media and everything, and getting our press releases out and communicating to the public. We're really proud of the work that she and the health department, Eric and his crew, have done providing information to the residents. We think that we have the best website in the state when it comes to data, maps, information, business community. We were one of the first counties to put in a recovery plan and get a task force together with local businesses to help them and put guidance on the website. We had other counties reach out to us and ask us for Word versions of that recovery document so they can, use it for themselves. Dan DeYear and the folks in emergency management have done a phenomenal job as well, planning, supporting Eric, supporting, everything that they need over in the health department. I know Eric mentioned that with his interview, but the best thing about Madison County is we all work together as a team, and everybody has all stepped up to the plate. And I'm just so proud of our department heads, staff, our employees. Our board has been amazing, so supportive. Whatever we need, the board's allowed us to do what we need to do to get the job done. I've heard kind of horror stories from some of my colleagues where gets in and wants to come in and micromanage the departments. The board lets me as the administrator, my job is day to day. I run the day-to-day operation. I make sure the departments get the support they need to do their jobs. The board supports me and the departments by allowing them to do their jobs. And I'm so thankful. It could have been a really much more difficult situation if we didn't have that support from our board and we didn't have phenomenal department heads executing the plans that we put in place. And I can't say enough how proud I am of everybody here and what a phenomenal job that folks have done. It's been really great. That's the best part about it all. It's frustrating, with the state and everything. You go to bed at night and you worry about the future. But I was telling Chairman Becker the other day, we were having a conversation about the future, and I said, in the end of the day, there's one thing we can all be proud about, is be proud about what Madison County brought to the table, what we've done. And what we can control, we controlled, and we did a great job with it. And, you even look at the greenhouse, there's still out there this sense of the county dropped the ball, or the county did a great job with the greenhouse situation. We were aware of an issue based on the hospital telling us that we had some positives, that we made the decision to test everybody, working with the state. And because of that, we quarantined 90 greenhouse workers. And because of that, there was no spread from that greenhouse. Those 90 people were quarantined, were safe. They were not in the community. And because of efforts that we took, we protected the community, and they could get into the greenhouse and the employee, the folks in the hotel rooms. That's a greenhouse. It's a big operation. We have a lot of contractors that come in to do construction projects, and they come in and they stay at the hotels and they are afforded the room. So, once we were aware of it, we did the right thing to protect folks and quarantine folks, and it really worked out well. So I'm really proud of everything that we've done, and I'm proud of all our employees. It's been really good. That part's been the best part. And we're still anxious for the future. We're really hoping the federal government's going to come through with an aid package to help us with our lost sales tax, to prevent the state from cutting us. The economy goes as the counties go. If the counties aren't there to provide the services, there is no economy. So I'm hoping the folks in Washington will get with a program and get us the aid that we need, give the state the aid that they need. Nobody planned for this. Nobody planned for a pandemic. So we need to make sure that we're supported. We have $700,000 that we can raise in property taxes this year to stay within the cap, and I don't know how we do that based on what happened with this COVID-19. So we're really hopeful that we'll get the support we need from the federal government. We can continue to provide the great services that we've been providing all along. I don't want to see counties go the way of the dinosaur. We need to keep going. We need to provide our services, and we need to support our residents. And the federal government and the state government are going to play a big role in making sure that happens going forward. It's all on them. We're ready, we're willing, we're able to work, we're able to continue to provide these services, but we are going to need help.
I don't think we can end it any better way, Mark. Thank you for taking the time to talk to us today. And we will hopefully, we'll see you upstairs, but we'll talk to you soon.
Yeah. And thank you, Matt, for everything you're doing. You're doing a phenomenal job as our historian, documenting this difficult time. And I always look forward to your new videos, and I won't watch this one with me because I don't like
you might want to. It's really good.
Yeah, thank you. But no, I appreciate everything you're doing downstairs, and you've done a phenomenal job. I laugh. I think about, you and I haven't been able to talk as much, but, last year this time, right before our courthouse celebration, we were together all the time in that great celebration. And that was like a tough 30 days. And it's like, this is a lot different and a lot more difficult, but, that was a fun party. You did a great job, and you've done a phenomenal job as our county historian. I'm very proud of you and your work. So
Thank you, sir.
All right.
Talk to you soon. Yep.
Thanks.
Bye.
Bye.